Diabetes is already hard enough to live with, but the shame, the blaming, the judgment, that part can hurt even more. And I've heard it in my own family and in my own community, things like it's their fault they ate too much fatty foods or sugary drinks. It's not that simple, and it's not the truth. Our people are living with the impacts of colonisation, past policies, trauma, food insecurity, limited access to healthier options, and environments that make it really hard to stay well. Many of our people are diagnosed young, sometimes even as children. So when someone hears those comments, that judgment, it doesn't help, it harms. It affects their mental health, their motivation, their confidence, and it can make managing diabetes even harder. I've seen the pain our families carry when young people pass away far too early from diabetes complications. The message that we share is simple. No more shame, talk good ways. Talk good ways means using respectful words, approaching conversations without judgment. When we talk good ways, people feel safe, they feel seen, and that safety can make all the difference in how someone manages their diabetes. That's why Diabetes Australia, with our partners through the National Diabetes Services Scheme, have developed our own short e-learning module for Aboriginal and Torres Strait Islander health workforce.
This e-module is really pioneering. It directly responds to the 2024 International Consensus Statement to end diabetes stigma and discrimination. It does so by offering an intervention that directly targets diabetes stigma and specifically within healthcare, adopting a culturally safe approach.
The learning outcomes for the module is that we are hoping the participants recognise what diabetes stigma is and where it comes from, but also to understand the experiences of Aboriginal and Torres Strait Islander peoples living with diabetes. We want the participant to understand and identify the prevalence and impact of diabetes stigma, reflect on personal biases and gain confidence in stigma-free care provision. And also, the best part about these modules is they provide practical strategies to reduce the harm caused by diabetes stigma.
It's also grounded in shared decision-making and genuine collaboration between an Aboriginal and Torres Strait Islander local reference group, alongside healthcare professionals, researchers, and diabetes organisations, bringing together scientific evidence from around the world along with local lived insights.
If we want better outcomes for our people, we need to change the way we speak, the way we think, and the way we support each other around diabetes management.
Together we can build healthier, more understanding communities and talk about diabetes with empathy. Diabetes does not define us, but stigma often tries to. Let's replace judgment with empathy and support. Our communities deserve better conversation.